his ears. That's the great sign.
When he looked at me, I could see my oldest son, so I did what I needed to do, got into the hospital, and then found myself a corner and cried.
Okay, so we're back. We found the guy.
Well, this is Chris.
This is Chris. This is not Dan. This is Chris. This is another dude. I think I'm gonna be. Are we gonna interview two people?
Yeah.
Okay, we're gonna interview two people. So yeah, now I'm just gonna sit here, wait around for a little bit. All right.
Do our reports and kind of hang out.
All right. Cool.
But that's just one of the. We have a large aspect of a job. We do long distance transfers. I've done all the way from Columbia to Kansas. They go all over the place. Routine transfers from hospital to hospital, hospital to a residence, hospital to a nursing home. There's just a lot of this job that, quite frankly, I don't think would take a while to talk about. We have all kinds of hidey holes and equipment and this, that, and the other. Suction catheters for suctioning out an airway if I'm going to intubate you. This is what we call the baby bag for our pediatric community. Has all kinds of stuff from infants all the way to 17, 18-year-old folk. We have a medicine pump that we can use, and the Alaris. It's kind of the same thing that they have in the ER, which is nice. We have air tanks. The bed is not the most comfortable thing you've ever slept on. Trust me, I've slept on it.
How much does the bed weigh?
Oh, that weighs, if I was to pick it up, probably about 120, 150 pounds. Now this is a power cot. It has the battery operated. You can pick it up, this, that, and the other. Other places use a manual cot still. They have to literally pick the wheels up. And the difference between those cots and the power cots is about 80 pounds. Like I said, we have all kinds of equipment in our cabinets. First aid kits. Like I said, it's a first aid kit on steroids. We have all kinds of... Somebody's going somewhere. That's our dispatch. And we have a bench seat that has all kinds of stuff. Linens, sheets. And then we have compartments on the outside of the truck. So hopefully that's helped.
Oh yeah. Tons. I gotta look. What does it take to become an EMT?
Okay, you have your EMT, which is what my partner is. You have the EMT basic, and then you have the EMT paramedic. Okay, the EMT basic usually goes to like 8 or 9 months of school. Then they have their the clinical rotation, and then they through the ambulance, and then they take a practical test, and then they take a computer-based test, and then about 8 or 9 months you can have your EMT license. Now, paramedic is something a little bit different. Once you become, my suggestion is, once you become an EMT, get some truck time, meaning work on an ambulance, work in an ER, to get time as an EMT working in that. So you get your patient assessments, you get your person-to-person assessment skills, because some people don't have the ability right off, or it takes them a while to where you can walk into some stranger's house and goes, hey, my name's Chris, I'm a paramedic, what's going on today, what seems to be the problem, thing like that. Now what I did is after I got my EMT license, I worked for 3 or 4 years as an EMT, and then I went to paramedic school, which is about a 2-year course, about a year, between a year and 2-year course, and that involves more clinical time. And that's in the hospital, and then you have your ride time on the ambulance, and then you take a practical, which is the hands-on part of the job, and then you take the computer-based testing, which is the studying of the book and everything you read into a huge 150 question test. Yeah, it's pretty intense.
Sounds monstrous.
It is monstrous. There's a different. Now, some people ask what the difference is between a paramedic and a nurse. A paramedic can intubate.
What is that? What is it?
Intubation means when you are not breathing, like on a cardiac arrest or respiratory or respiratory arrest or no longer being able to breathe on your own like some asthmatics do, we will put a tube down your throat into the lung area, down the trachea, and then bag and help breathe for you. Okay? Nurse can't intubate, but paramedics cannot type and cross blood. And that's a whole other gambit inside the hospital. That's something that they do. So a lot of the medics, after working as a paramedic for 5, 6, 7 years, what they'll do is they'll take the nursing course or they'll take a bridge course from paramedic to RN to increase their knowledge, or as we all get older, to kind of not have to be out in the elements or move as much weight or things like that.
You do this work?
Well, I was kind of born into it. I'm a third generation EMT, first one paramedic. My dad worked on the emergency response team at the nuclear plant where he was employed for like 23 years. So it was just kind of one of those where some of us are called to it, some of us are just born into it. When you deal with patients, they come in all sizes.
Yeah.
So you have to, not only are you trying to help those people that you go on calls for, but you have to maintain your strength. You have to maintain your cardiovascular.
So it's a very physically...
It is a very physically demanding job. And unfortunately, a lot of my brothers and sisters in the paramedicine field in EMS have been retired early because of back problems, knee problems, things like that. So it's, you have to, it gives you a whole new mindset on you. For example, I've seen some paramedics that weigh anywhere between 300 and 400 pounds, and they're trying to more or less kneel down to help somebody when they can't get down on the ground. Does that make sense?
Next question real quick. What do you dislike most about this job?
I don't like 24-hour shifts. I don't normally do 24-hour shifts.
Yeah.
When I was a younger man, the 24-hour shifts didn't bother me because when I was in the military, I could go to sleep anywhere. Becoming an older man, I find that getting up at 2 o'clock in the morning to run on a call is a little harder. The parent in me comes out sometimes. And I hate to say this, but sometimes you have to, I don't want to say squash it, but kind of put the parenting part down on a pediatric call and do what you need to do to make sure that the outcome of that patient is everything it needs to be. Now, my wife is an LPN, and what her and I call, we do what we need to do and crumple later. For example, if I run crumple. Act now, work now, crumple later. When we work pediatric calls, there's been times I worked a kid that was in an asthmatic problem or an anaphylactic reaction. When he looked at me, I could see my oldest son, so I did what I needed to do, got him to the hospital, and then found myself a corner and cried. I mean, don't let the bald head and the beard fool you. I will cry with you just as quick as you will. But that's the challenging parts for, I think, most of us in EMS and those of us that are their parents, is the pediatric call that we do, and we do a huge amount. We are a jack of all trades. We do respiratory, we do pediatrics, we do cardiac, we do geriatrics or our aging community. We do public education. We do just a gambit of things. A plethora is a word I like to use. A plethora of things. So EMT paramedicine, the EMS service as a whole is a constant circle of learning. It never stops. Never stops. Once you get learn about cardiac, then you move on to something else. Knowledge is just wonderful, and the learning never stops. So that's one thing that we constantly do, is we constantly go to seminars, we constantly read, we're constantly reading protocols, we're constantly on the internet researching things, medications, new protocols coming out with American Heart Association. I could go on and on, but I don't